Welcome back. You'll probably be surprised at how many people suffer from irritable bowel syndrome. It's one of those things that no one wants to talk about, but here's proof of just how widespread it is. After colds, it is the #2 reason why people book off sick from work and school. Dr. Lawrence Cohen specializes in the disorder. Suzanne is one of his patients. Thanks so much for being here.
Thank you for the invitation.
Irritable bowel syndrome is what exactly? What's happening inside Suzanne and other people's bodies who suffer from it?
Irritable bowel syndrome is traditionally thought to be a disorder of the movement of the bowels. If you think the bowels as a machine that works effortlessly, taking in some fuel, passing it out without any pain, with normal exhaust, with normal output, that's the normal way we function. Patients with irritable bowel do the same thing in their life, but they often have pain, bloating, excessive gas, and an altered bowel habit that is extremely disruptive to their lifestyle.
We're going to show an image of the digestive system, and if you can, using that image, explain to me what's happening inside the body, though. Why is the passage not the way that it is happening in someone who has normal?
Well, as you can see from the diagram, this is a schema of the entire internal structures, and we're talking about the bowel, which is in the lower half of the image. And what happens when you ingest food, which is one of the factors we may be talking about as a cause for irritable bowel syndrome. Food is digested through the gut, and when acted upon by bacteria, may yield excessive gas production, may change the motility pattern of the bowels, and result in crampy abdominal pain, abdominal bloating, distension, and an irregular bowel habit of diarrhea alternating with constipation, or in fact being predominantly one or the other, predominantly constipation, irritable bowel syndrome, or a diarrhea-dominant irritable bowel syndrome.
Because there are two, right? I mean, there's IBS-C, which is what you suffer from, Suzanne, and then there's IBS-D, which is the other.
That's if you're a lumper or a splitter, no pun intended. But if there's a blend of the disorders, some people tend to have a constipation-dominant irritable bowel syndrome. That is, most of their day is spent with constipation, whereas some are diarrhea dominant, where they have more frequent bowel movements than in the constipation form. Some people have both. Some people just have pain dominant irritable bowel syndrome with a relatively normal bowel pattern. So it really is a spectrum. And that spectrum is very important to differentiate in terms of a treatment approach to the individual.
Now, how common is it, Suzanne's story of having sort of symptoms of this when she was a very young child, it disappearing for a decade and then coming back?
It's actually quite common. We know that children who suffer from little belly aching complaints often grow to have irritable bowel syndrome as an adult experience. But there's no genetic, at least no recognized genetic risk for developing irritable bowel syndrome. It's an acquired problem related to a variety of factors, diet, lifestyle, and one's own biology makeup.
But so, I mean, Suzanne, can you think of anything that happened in those 10 years when you were free from this problem that would be different, that would have triggered later on it coming back?
No, and I don't really think in the 10 years that I was free from the problem. I just think that I learned to cope with it more. And I was so involved in being a teenager and living an active lifestyle that it became a second thought. And when you're not thinking about it so much, you it's not on the surface, and you just learn to cope with it.
And Suzanne's history of sort of going from doctor to doctor and being told basically that it's all in your head, is that a normal situation for people who are going through this?
Regrettably, that is a common experience. And I say regrettably because that's a very old, traditional, and archaic perspective of irritable bowel syndrome, that it was all in your head. That was the perspective in the 50s. But as decades evolved, although the causes of irritable bowel remain elusive, we now recognize it's not all in the head, it's all in the gut, and that it's an evolution of something called visceral hypersensitivity, which is a fancy term meaning the gut is super sensitive to diet factors, lifestyle factors, and so on. But we now recognize that there is a biocultural model of this, and I refer to that term. In fact, the National Post journalist Marnie Jackson just had a wonderful article on gender perception of pain in this past weekend, and they looked at the biocultural model of irritable bowel syndrome. And in fact, there are many factors here. Biological makeup, the role of serotonin in our bowel, as well as the cultural influence.
Cultural influence meaning what we're eating?
No, the way we can express it. How does one express their pain in our society? And often the bowel is a source of that pain that can be expressed and may not be expressed, may be actually repressed, so that there is a biological model for pain, and that's the serotonin or other neurotransmitters.
And we're going to get into that in a little bit later in the show because it's an interesting aspect. We think of serotonin being something that's in our head, but there is a connection to the gut as well. I want to talk to you about how this illness breaks down along gender lines.
Well, as I say, it's a very intriguing question because in our society, gender plays a very important role in the expression of pain. It seems that you can look at it from the biological as well as the cultural model. Biologically, everyone is made up uniquely. So we all have our own perception of pain. We all feel pain differently. And that may be a function of the hormones in our body. Women, because of monthly fluctuation of hormones, have different expression of pain and perception of pain than men. Also, there may be a different composition of serotonin in women than in men. And that's why it tends to be a predominantly female-expressed disorder in our society. Then there are the cultural aspects. How does man express pain? How does a woman express pain? And that really is culturally dependent.
So are you suggesting that a man wouldn't be expressing the pain that he's feeling, so would be underdiagnosed?
That may well be the case. In fact, in our society, women outnumber men with irritable bowel syndrome. In other societies, men outnumber women. And it's believed to be due to a cultural expression of perceiving pain and expressing pain.
Okay, on that note, we do have to take a break, but in just a moment we're going to meet a man who felt so alone, so frustrated by the lack of support that he started his own IBS self-help group. Please stay with us.